Good day, my name is Johan Olivier from the company MyLife. We present a lifestyle management platform that especially focuses on financial, emotional and social wellness. With the break of the coronavirus and the huge demand for understanding what's happening, we thought it good to speak with Dr. Anton Prinsloo from OnDemand Doctor, a company that has various outlets in Gauteng region, to give us more information about the coronavirus. And therefore we posed a couple of questions to him, and we really hope that this will be helpful to you as a MyLife user.
The coronavirus is a large family of viruses, of which the common cold is one, that's usually a mild disease, till the SARS virus that was around a while ago. And lately the newest coronavirus is then what we call the COVID-19 virus, or the novel coronavirus. The common signs of the infection will be fever and cough, respiratory distress, difficulty in breathing, and it can even lead then to pneumonia and kidney failure, and sometimes even death. The mortality risk for coronavirus is much higher than the normal flu viruses. The important thing is that as time goes along, we're going to find a lot of changes in the policies that we're currently having. And what is important is to use trusted sources of information. And the two trusted sources that I can refer you to is the World Health Organization. You can go and look on their website, and also the National Institute for Communicable Diseases of South Africa. Now, as we learn about the virus, as I said, the way that we will manage people is going to change. So the National Institute for Communicable Diseases is currently the organization that we use to test persons. And we talk of a person that needs to be tested as a person under investigation, a PUI. And currently it will be somebody that's having the flu-like symptoms like I've described, plus then a fever above 38 degrees Celsius, and then who has been in contact with somebody that's been confirmed having the coronavirus infection, or then somebody that has traveled abroad and came back to South Africa from one of the countries where the coronaviruses are already. And these persons, we will take sputum samples and send them to the NCID. We will then test them for free as well. The spread of the virus is mainly through droplets, and that comes from the nose and from the mouth. And the prevention then is to try and reduce the risk of the droplets moving from one person to another person. So when a person sneezes or coughs, the droplets will go into the air and then it can be inhaled. That's one way of getting it. The other way is the droplets can fall on surfaces where it can stay for and live for a couple of hours to a few days. And then if you touch those surfaces and then you touch your nose or your mouth, it can be transmitted to you in that way. So it's very important that we, when we touch surfaces, or that we wash our hands frequently with soap and water, or then with spray it with alcohol-based spray. When a person coughs, it's good to cough in the elbow, or use a paper sneeze towel to cough in, and then just dispose of that. So we urge South Africans with respiratory infections and corona infections to use good hand hygiene, stay at home until they are better, and then also use good cough hygiene. The wearing of masks is a hot topic at the moment. It's important to understand that wearing of a mask alone is not good enough to prevent the spread of diseases. One should still practice washing your hands frequently, and then also staying away from people that has been affected. The treatment is currently just symptomatic and supportive treatment. There's no antiviral medicine available. The usual flu medication that we take, the antivirals, will not be effective to treat the coronavirus. There's also no vaccine out yet for the coronavirus. Currently, the World Health Organization is speeding up all efforts to try and find a vaccine and a cure. There is, however, the normal flu vaccine that is coming out in March and then also in the beginning of April. And this year it is very important that we all go and get the flu vaccine. If you suspect that you've got the coronavirus, there is a public hotline number available, 0800 02 9999.